Adrenocortical hormones. Classification of adrenocortical hormones. Glucocorticoids, mineralocorticoids, sex hormones. 1. Glucocorticoid. Short-acting, hydrocortisone, prednisone, 8 to 12 hours. Intermediate-acting, triamcinolone, 12 to 36 hours. Long-acting, dexamethasone, 48 hours. Pharmacokinetics. Well absorbed after oral administration. 75% of corticosteroids are bound to plasmaglobulins, CpG. CpG is increased by estrogen and decreased in liver cirrhosis. Metabolism is by the liver and excretion is by the kidney. Mechanism of action. Corticosteroids transported to the nucleus, where it interacts with many DNA receptors, genes, and affect their function. Pharmacological effects. On metabolism. Carbohydrate metabolism, hyperglycemia, peripheral glucose utilization. Protein metabolism, catabolic effect, muscle mass and thin limbs. Fat metabolism, lipolysis with redistribution of fat. Na plus and water retention and hypokalemia, anti-inflammatory and anti-immunological effects. Inhibit antigen-antibody reaction. Inhibit lymphocyte and macrophage activity and function. Stabilize lysosomal membrane. Release of inflammatory mediators and cytokine production by inflammatory cells. Inhibit phospholipase A2 enzyme, so reduce synthesis of PGs and LTs. Capillary permeability. CVS, hypertension due to Na plus and water retention. Hematological effects. RBCs and lymphocytes and eosinophils. Coagulation factors and blood cholesterol. On growth. Growth retardation, which is not prevented by growth hormone. On bone. Bone matrix and Ca2+ excretion, osteoporosis. Inhibit hypothalamo-pituitary adrenal axis, doses. Short-term therapy, duration of therapy is less than 2 weeks. Long-term therapy, duration of therapy is greater than 3 weeks. Alternate day therapy, double the dose and give it every other day. Therapeutic uses. As replacement therapy in adrenocortical insufficiency. Acute adrenocortical insufficiency, acute Addisonian crisis. Chronic adrenocortical insufficiency, Addison's disease. Adrenocortical hyperplasia due to elevated ACT. Congenital adrenal hyperplasia. Cushing syndrome, due to pituitary adenoma, adrenal tumors. Stimulation of lung maturation in the fetus. Anti-inflammatory, for example vasculitis, rheumatic fever, arthritis, bronchial asthma, etc. Allergic diseases, for example anaphylactic shock, urticaria and bronchial asthma. Autoimmune disease, for example SLE. Shock and hypotension. Organ transplantation, as immunosuppressive to prevent graft rejection. Cerebral edema, dexamethasone is used after brain surgery to minimize edema. Acute hypercalcemia, to enhance Ca2+ excretion. Side effects. Acute adrenal insufficiency, acute Addisonian crisis. It occurs after sudden withdrawal of corticosteroids after prolonged administration. Prevention, gradual withdrawal of corticosteroids. Iatrogenic Cushing syndrome. Occurs if high dose is used or it is used for greater than 2-3 weeks. It is characterized by moon face, buffalo hump, weak muscles, osteoporosis, hypertension, DM, edema, etc. Immune suppression leading to flaring of infections, especially viral and TB. Decrease wound healing. Peptic ulcer. Due to prolonged PG suppression. Rise of IOP, glaucoma. Hyperglycemia. hypercoagulability leading to thromboembolism, osteoporosis, retardation of growth in children, pregnancy, congenital cleft palate, local side effects, skin atrophy and hypopigmentation on prolonged use. Repeated administration in joints may produce joint destruction and infection. Contraindications: presence of infections, especially viral infection and TB, because corticosteroids can inhibit immune functions. NB uses of corticosteroids in presence of T.B. TB meningitis, to prevent adhesions. TB of the suprarenal gland, to correct hypofunction. Miliary TB, to TB toxemia. Peptic ulcer, the synthesis of PGE2 and I2 that protect the stomach. Hypertension and heart failure, they cause salt and water retention. DM, except fluorinated corticosteroids, for example dexamethasone and betamethasone, because they have anti-inflammatory with less hyperglycemic effects. Mental disorders, for example psychosis or depression. In early pregnancy, may cause cleft palate. Drug interactions. With NSAIDs, incidence of peptic ulcer and decreases its healing. With insulin, it has anti-insulin effect, hyperglycemia. With anticoagulant drugs, it decreases their effect. With loop diuretics, it aggravates hypokalemia. Mineralocorticoids, natural mineralocorticoids, aldosterone. It binds to specific intracellular receptors in the distal convoluting tubules to inhibit Na+ excretion and stimulates K+ and H+ excretion. 2. Synthetic mineralocorticoids. Deoxycorticosterone acetate DOCA. It has mainly mineralocorticoid effect. Fludrocortisone. It has both glucocorticoid and mineralocorticoid effect. Adverse effects: hyponatremia, hypovolemia, hypokalemic alkalosis, weakness, paralytic ileus and tetany. Hypertension. Therapeutic uses: acute adrenal insufficiency, chronic adrenal insufficiency, Addison's disease, hyperaldosteronism, treatment of hyperaldosteronism. Primary hyperaldosteronism, by surgical removal of tumor. Secondary hyperaldosteronism, aldosterone antagonists, spironolactone. Adrenocortical hormone antagonists. Glucocorticoid inhibitors. Aminoglutamide. Inhibit steroid hormone synthesis. Used in adrenocortical malignancies and cancer breast. In postmenopausal or overreactomized women with metastatic breast cancer, to eliminate adrenal estrogen production. Meteropone. It inhibits enzyme necessary for synthesis of glucocorticoids. Used to measure the capacity of the anterior pituitary to secrete ACTH. Ketoconazole. It is antifungal drug with slight inhibition of mineralocorticoids synthesis. Used in Cushing's syndrome. Mifepristone. Blockade cytoplasmic glucocorticoid receptor. Inoperable patients with ectopic ACTH secretions or adrenal carcinoma. It is also an antiprogestin, B-aldosterone receptors inhibitors. Spironolactone. Blockade of cytoplasmic mineralocorticoid receptor. Used in hyperaldosteronism.